The general business, item 4A, update to code 50-55.
Thank you, Madam Chair, members of the committee, Sean Dave, presiding judge. You should have in front of you a draft ordinance to update code section 50-255. That's our code section that relates specifically to probation conditions. When we did the review and the adoption of all the requirements for House Bill 1222, I was pausing just to see if I needed to wait. We also reviewed the standard conditions of probation that are on our code. And there was some need to do some clarification so that they would not be in conflict necessarily, and to do some updates with some of the language. So that's what you have before you. It's to include some of the sections of the state statute within our specific code, and to also just update some of the language. Happy to answer any questions.
No question.
We're good, thank you.
Well,
Item 4B, IGA with Colorado Judicial Department for provision of jury list.
We're just changing the vendor. Our current vendor is not providing some information that we need for our jury list. So we're going to the state. So this is what this is. It's just an IGA with the state to get our jury list once a year.
Self-explanatory, I think we're good. Great. Item 4C, you.
All right, so this is our public safety action plan. Item 1 is making sure that we're fully staffed, and you have the numbers there. Do we have any updates on the academy that's in progress, or the January academy? Any major changes to or updates for the committee?
No.
Okay. Okay, and so we'll probably have firm numbers hopefully next month to give you guys what we're looking for in January, but still on track for that 30 to 35.
Great.
We have that in the second account. Do we have a second academy, Bill?
So our next one starts in January.
And that's the one we're hoping for 30 to 35 right now. So we're kind of trying to complete that process now.
That's in addition to the current.
Correct.
Okay, okay.
Yes.
Yeah,
Yeah.
absolutely.
So we're just now getting applicants coming to us, so
Much better than the 3s and 4s and 7s that we were having.
100%.
Yeah, okay, perfect.
How we keep it that, we should be fully staffed by the end of next year.
So then on item 2, in terms of being data informed, in terms of our key numbers, we've seen a little bit of an uptick in murders, unfortunately, over the last 4 weeks. So I think for the year, unfortunately, that's taken us up over last year. So you can see those numbers there. And then you kind of see that motor vehicle thefts and robberies are trending down both over the last 4-week period and year to date. Questions on those? We're gonna do a deep dive on those murders. The department does always a very good job of that. In terms of, making sure that we explore the relationship of victim to the offender. We do not think that these are random events. Typically, these are individuals that are known to each other. So again, not great news, but don't construe this to be random acts of violence.
And another point too is that right now we're probably sitting at a 67% clearance rate for homicide for the year. And obviously that's going to increase as we continue to work our investigations. And that's really well above average, nationwide. So I think last year we were in that 80% range in terms of our clearance rate for homicides.
I do have one question. There was a murder, Lumumba's son, and I believe he was murdered in Denver, but his body was dropped in Aurora. Is that in our stats,
No.
or is that in Denver's?
No, that's a Denver homicide.
Okay.
Yeah, where the incident happened.
Okay.
Any questions on second item? Item 3, this is our youth violence.
Joseph's
Online. Oh, Joseph's online. Thank you, Joseph. I'll let you turn it over to you to give any updates on youth violence.
Absolutely. Thank you. Good afternoon, Council. Not too many updates in terms of case management, those types of things. We did just add a screenshot below. So that's the dashboard, a screenshot of the dashboard we're in the process of building out for the NOFO grantees. That number at the top right, the youth served to date, is actually just over 1,100 now. In the last week and a half, we got an update of data. So what we'll be doing in the next few months is breaking out. On the left, you can see all of the agencies that we funded. So each agency is going to have their own dashboard. for youth served and some of that demographic information, but this was just kind of a snapshot overview that we wanted to share with you. The other updates in terms of Aurora Saves, so we started custom notifications, Captain Hannafin, myself, Shannon, our case manager, on September 27th, and doing those weekly, about 3 to 5 individuals each week we've been contacting. And we have had 2 individuals that have reached back out to us to accept services. So we have just actually Tuesday, we completed with our case manager the needs assessment with those individuals to get a better picture of what their needs are, what the family needs are, those types of things. So we'll have some additional information, I would assume, next week or so about what that's going to look like. But I believe you probably received an invite for December, so we're just doing a 4-day kind of celebration, year-end celebration with all of our NOFO grantees to come together and talk about their successes and just try to enhance that collaboration amongst the grantees. So hopefully we can see you all there. And then again, just to update you all, we are in the stages of a youth empowerment center. I know we touched on this last month, but we've got meetings in the next couple of weeks just to make sure we're engaging the school districts and those individuals. I believe that covers it for you finalists. Any questions, I'm of course happy to answer.
Any questions for Joseph on the final stuff? Okay. Thank you, Joseph. All right, on our fourth is our crisis response team staffing. So Courtney, I see the stats here, but any additional updates?
Only a few updates more regarding training and just different initiatives that we're pushing out in the department. We've been working really closely with Aurora Fire to kind of coordinate some joint training and consistent policies across both departments to have a better, more cohesive approach to mental health calls. So that's been very effective. Very grateful for Chief Weber and Commander Hill over there and that whole leadership side. We also recently pushed out a series of informational videos to our patrol as well as Aurora Fire on different informational things such as, what is an M1? How do we do a good M1? Things such as that. And the last update I'll give is that recently we provided a presentation and training to some partners in Colorado, and that actually warranted a bunch of attention to our program, to our targeted violence prevention program. And we've had the National Park Service reach out to help them set up their targeted violence prevention program.
Yeah, so Courtney and her team have been recognized as national leaders, so we're glad you guys are getting that recognition. Keep up the good work. Courtney was kind enough to provide to me, not in time for this meeting, but I think either in December or January, we'll get you guys a nice annual update, not only on the number of calls we're responding to, but she has really good numbers on outcomes in terms of, the fact that our teams are able to have really good outcomes in terms of having folks be able to be seen, in-house. We're able to de-escalate and get good outcomes. So we'll get you guys an update either next month or in January to not only just the fact that we're responding, but that I think they're doing a great job in terms of those outcomes. So we'll provide that. We'll work with Courtney to see if we can do December or January.
I have a question. Courtney, so I appreciate all the work you guys are doing, and it's great. I look forward to see what the outcomes are. In terms of demand and the need for more clinicians and resources to do that, can you put that maybe next time, say, if we had 1 more clinician, 2 more clinicians, 5, I don't know what the numbers are, but just I'd like to see what it would be and how it would work, and then what the cost would be, 10, I don't know. I'm being really serious, because if the outcomes are, ultimately, I think it's important to our community and important to those of us on council to see this program grow to meet the demand that's out there, because it's having a positive impact. So I don't want it to be limited because of resource constraints, because we can figure out ways to.
It's a great topic, great transition, because Courtney's also been working with Tina in terms of making sure that we're trying to get to a point where we can directly dispatch them. So we'll include that as part of that. It's a great point in terms of both, what the demand is ultimately, what we're seeing now. We're not quite where I think we want to be in terms of directly dispatching them, but we do know that there's demand out there, and both our officers, our firefighters, and our public, I think we're getting really good outcomes, and the demand's there.
Absolutely, Councilmember. We've done some preliminary research on the actual total mental health calls for service or related mental health calls for service coming into the city. We want to parse it down, not parse it down, but make it a little more specific to get the most accurate number. We had planned to bring that to this particular council committee meeting, but I don't think it's quite ready. I'd like to have more of an accurate number. But from those preliminary data, it's about 10% of all of those calls is what we're able to respond to on a year basis.
I'd like to see that number grow. It's obviously a great outcome, so thank you.
Thank you.
Okay, so that's that one. And then finally on our homeless camp cleanups.
Yep, I'm right here.
Oh, there.
Hey, y'all.
You switched
I'm
on me.
always
There we go.
hiding in the
Okay,
back.
all right. So, all right, so Em, go ahead.
Thanks. Yeah, so as you can see, actually the numbers aren't up there. We had 142 notifications received for homeless services. There we go. About encampments in October. Of those, we were able to do 42 abatements. And as I normally say, that 142 is usually a lot of duplicates of the same camps that we're getting reports on. And of those 42, 11 were CDOT related. Most of those are usually 225 and Parker, which we hit every single Tuesday we go there. So we are there every week, and sometimes more often than that. And let's see, we had 2 people accepted Comitis in October, and we'll probably see a little bit higher numbers accepting Comitis now that it's getting colder out. That just tends to happen a little bit more. And 19 people were placed in pallet shelters. 2 people were housed through those pallet shelters as well in October, which is a pretty good number. Housing's really hard right now. And I had a new staff member start on Monday. She's going to be helping with the abatements as well. So now I'll have a team of 2 with that. So I think they'll just be more efficient and be able to respond to people in a more timely manner. It's been really hard for my one staff member to keep up with everything. And I neglected to put it up there, but we had our outreach staff start at the beginning of, or maybe it was halfway through October they started. So they are still in onboarding, and it's a new program, so that's going to take a little bit to really like hit their stride and be doing what we need them to be doing. But they're learning, and they're going to be supporting the abatements and getting folks to pallets in a more timely manner and providing those services that they are receiving elsewhere.
So I guess for me, I love that you guys are hitting Parker 225 every Tuesday. My concern is that pattern being established, they're gonna figure that out. So they're gonna move back in Tuesday at 5 PM when they know you've gone home for the day. And so maybe with this new additional staff member coming on, maybe we can look at switching those times up. Or even beginning to go twice a week, because I would say by far Parker and 225 is where I get the most emails. By far.
Yep, we get the most emails for that as well.
Yeah.
Totally understand that. So we do it on Tuesdays because that's where the PAR district is, or the PAR district is available that day for that one. So it's kind of based on that. They have said, I believe that they are able to do it occasionally on Fridays as well. So we'll do it probably not every Friday, but when staffing's available. So 2 times a week is kind of where we're moving to. But part of the issue that I know you know is it's Arapahoe County down there too, and there's a huge camp on Arapahoe County property that we can't touch right now. And
They're not willing to do anything?
what's that?
Arapahoe County, the commissioners are not willing to do anything?
Generally, they don't have a policy on it right now, which means they're not really acting on it in a proactive manner like we are. So we've been in talks with them for quite some time. It's not going great for the most part.
I'm a huge fan of Arapahoe County, so I'm willing to be a part of those conversations at any point. I just love Arapahoe County, so anytime you'd like me to show up, I'm thrilled.
I will keep you posted. Thank you.
Okay, all right.
That's all, ma'am, unless you have other questions for us on this item.
I do not. Miscellaneous matter, do you? I'm sorry, you're here too.
No, I don't have
Okay,
any.
We've got a
okay.
couple updates if you're okay with it.
Yeah, miscellaneous matters.
We'll ask, I'm gonna have Chief Weber on the spot. I'm gonna ask him to tell you about this piece of paper you have in front of you here, and then also give you an update, early update in terms of how our first couple weeks of right-sizing response is going.
So, yeah, so
Actually, this is Commander Hayden.
Oh.
So, this is just an invitation, academy graduation, Thursday, November 30th. Everyone's welcome. It's at 6 o'clock. And then the next one on the backside is we're doing a de-escalation training. This is number 3?
Fourth.
Fourth. So we started small and worked up. This one is, the reason we're inviting you to this is that we actually have actors. So our crews are coming out there. We have actors that are, have a scenario base that they do, that our actors work, and then our doctors are there to tell them that, to critique them. We've gotten, the crews love it. I've not heard one bad thing about it, and it's going really well. And we sent this to, we handed this out at AKT-CRT, and then we're also inviting everybody else, because we'd like you to come out and if you want to, come out and look and just see. And a lot of this, we have to say thank you to PD, because we're kind of following off of them. I know that Commander Hayes worked with Shipley.
Lieutenant Shipley.
Lieutenant Shipley out there. So we're trying to, with this de-escalation training, police and fire doing the same thing. And I believe that's what we're doing now. So it's just we're just inviting everybody to come out and watch. I give kudos to Commander Hayes for getting this moving forward like it did, because it's helping our crews and it's also helping the citizens that we're serving. And then priority dispatch, we started a little over 2 weeks ago. It's doing better than I even expected. It's taking away about 30% of our calls. So that's just our alpha and omegas, very low level. I've had a headache for 2 days. We used to send a engine or a ladder truck emergent, and now it's a 2-person rig and they're handling that call. So our citizens are still getting their EMS. It's just the right size EMS, and it's not, we're not coming to that. So our crews have, especially the ones here in the central part of the city and up north, have noticed a tremendous difference, especially in their sleep patterns at night.
The other thing we'll add there too is, again, that in addition to changing what folks see, what they're not seeing is that 4-person firefighting rig is available for a higher priority call, for the heart attack, for the structure fire. And that's the difficult thing to measure. And again, so in addition to not rolling on that call, we're not having to pull folks from second and third due stations. So it's.
Are there ways to quantify the cost savings that you'll incur?
It'll probably take a year or so, because I know it's gonna save on tires.
Yeah.
On those rigs, fuel.
Yeah.
It's gonna save on just wear and tear on the engines. So yeah, that's something that I truly believe that we get reports from fleet on what we pay for, when they go in for a PM. I truly believe we're gonna see a cost savings trickle down off that, but it's gonna take a year.
Yeah, makes sense.
Yeah.
Sounds great. Yep. Cool. Does anybody else have any miscellaneous matters?
I'll jump in. A couple of things, just to add to Chief Weber's update. We're also working to expand the number of medical issues, low acuity, that we're going to refer to nurse navigation. I do have a report that I can forward to you for review. But with our annual report in year 1, we're finding that the estimated cost savings for patients and also to the city is upwards over $1 million in the year for the reduction of service and the diversion to nurses. With the increase of number of determinant codes that are being referred, in addition, the nurse navigation program is now transporting with rideshare individuals who have a low acuity issue. They need to be seen in person for their issue, and perhaps it's an after hours or over the weekend situation where an urgent care is not open. They're offering the ride share as opposed to sending an ambulance. So this person is still has a low acuity issue, but we're going to see a drastic reduction in the number of referrals that come back to us for transport, and even the reduction in BLS transport as a whole as a result of this. So we'll have a year of that expansion, and then we will report back on the metrics for that as well. And then the only other thing I wanted to share is we hired 8 more people. They started Academy 23-4 on Monday, and that brings us to 97% staffing.
That's really good. Okay. Oh,
Tina, can I ask you a question?
yes.
So at ICP, it came up that I guess one of the vendors is working with dispatch to get the ability to have live video feeds on 911 calls. And so I've been meaning to ask you, started asking in this forum, do we have an update on that for council and how exciting this is that people can actually during 911 get a link and then show what's happening on their video screen?
Yes, we've been researching it for probably 2 years now. And council members Zvonek and I were just discussing it, but we've actually found a vendor that has integrated next gen 911 capability in the call handling system, and we are funded.
That's who I met with, yeah.
Yeah, so
Okay.
we are scheduled to replace our call management system in 2024. But this will allow us not only to bring all of the next gen 911 capabilities and a way to preserve all of that evidentiary information very easily and distribute it, but it will also greatly expand our ability to engage our non-English speaking community, which is 30% of our city. So integrated voice, language detection, translation, transcription, and voice translation back to the caller, which is going to also greatly reduce the time it takes because we're not going to have to third party with a human interpreter to deploy services to a location. So we're going to see our service to those communities like greatly improve once we are able to initiate that new technology.
Awesome. Okay. Does anybody else have anything else? Okay, so couple things for me. So for next month's meeting, we're not gonna have one unless there is a pressing issue, time sensitive, that, you know, you guys need to get to full council before the meeting in January. Obviously, you know, we just had an election Tuesday night, so we will name a new mayor pro tem that will assign new committees. I am going to request to remain the chair of this committee, so I hope to see you all in January. But unless there is something, like I said, time sensitive, we're not gonna have a meeting in December. And thank you all for this year, just in case I'm not the chair next year. But thank you all very much. I know that I am the only one that has an in-person policy committee, but that's just the way it is. Public safety is that important to me. So with that, thank you guys so much. This meeting is adjourned. I didn't beat my record though. My record was 116.
I remember that.
That was my record.
Yes.
Didn't beat the record.
Do you have a full number?
I know that's.
What if it-